All right, good afternoon, everyone. We're going to go over Medicare basics today, and what we're going to focus on is the difference between a Medicare Advantage and a Medicare Supplement plan. I find most people don't know the difference between the two plans, and knowing the difference is very important because it's vital, in fact. Because if you know the difference between the two, you can then take your own personal situation and apply it to the plan that fits best, because Advantage plans and supplements are very different. They have different strengths and weaknesses, and you need to know the difference between the two so you can find the one that fits you best. So to understand the difference, we're going to first focus on Medicare A and B, original Medicare A and B, because you need to have a basic understanding of that as well to then see how a Medicare Advantage or supplement plan will cover you. So we'll hit original Medicare A and B. So Medicare Part A, which most people get at no cost. Part A covers inpatient hospitalization and skilled nursing. Also covers home health care as well, but we'll focus on the two main benefits, inpatient and skilled nursing. When you go in the hospital, inpatient in the hospital, you pay a deductible of $1,340, and these are 2018 cost share levels. So you pay a $1,340 deductible, and that is reset every benefit period. So if you go in the hospital, come out, and you're out for at least 60 days, and then go back in, that's a new benefit period. So you'd pay an additional $1,340 again. So it's every benefit period. For the first, after you pay the $1,340 for the next 59 days, so for days 1 through 60, you're covered in full after that. If you're then in the hospital for days 61 through 5 per day at that point. Medicare Part B, which most people will enroll in, some will not if they have work coverage, but most people will enroll in Medicare Part B. Part B covers outpatient medical services such as doctor's visits, scans, labs, testing, anything done to you, an outpatient surgery, anything done to you on an outpatient basis, not in the hospital, falls under Medicare Part B. Most people pay $134 a month for Part B. There are some people that pay less if they enrolled, if they became eligible for Medicare some years ago. And there's some people that pay more based on their income. But again, we're not. Our focus here is explaining original Medicare, supplement, and Advantage plans, so we're not going to get into too many details here. Again, it costs $134 a month for most people. If they're drawing Social Security, it comes out of their Social Security check. If they're not drawing Social Security, they're billed quarterly for it. Medicare Part B has an annual deductible of $183. That goes up in various years, but for 2018, it's $183. After you pay the one-time annual or one-time per year deductible of $183, you're covered at 80%. Medicare covers 80, you pay 20. There's no cap on the out-of-pocket costs for this coverage, so it's unlimited, the 20% that you could pay. Okay, as I just mentioned, talked over my slide, original Medicare has no cap on annual costs. That's for A and B. It also does not include prescription drug coverage. So what can you do to help cover the costs that the medical costs not covered by A and B, or at least to put a cap on it, and how can you get drug coverage? And that's where the Advantage versus supplement comes in. You could either enroll in a Medicare Advantage plan that would give you medical and drug coverage, or you could purchase a Medicare supplement plan and a standalone RX plan or a PDP plan by a private insurance company. I like to use this slide a lot. This will help us with the explanation of the two different options. So at the top in step 1, as you see, there's the Medicare A and B we talked about. And remember, people pay the average person pays $134 a month for Part B. Hospital, there is no premium for most people. And it gives you the coverage we just described. So your first option, what you could do is you could go with a Medicare supplement and a drug plan. What that means is you leave your Medicare A and B as your primary insurance. So when you go to the doctor, the hospital, the lab, you show them your Medicare A and B card. Your doctor, hospital, or lab bills A and B. A and B covers the portion they're supposed to cover. And then what's left over is sent to your Medicare supplement under option 1, the green option. So what's left over for cost share is sent to your supplement. Depending on the supplement you've purchased, it will cover some or even all of what's left over, depending on the plan you choose. You hear a lot of names of various companies that sell supplements. Some of the ones are very common. I'll leave names out of it for this presentation. But there's no paperwork for you to file or anything such as that. Simply Medicare's billed, what's left over is sent to your supplement, and they cover whatever portion they're supposed to. You then would buy a standalone Part D drug plan because supplements don't cover drugs. People always say to me, I want the government's Part D plan. They actually don't offer one. Part D drug plans are standalone plans offered by a private insurance company. And that's a plan you would purchase. You'd pay a monthly premium for it, just like you do for a supplement. And that would give you your drug coverage. When you go to a pharmacy, you'd show them your standalone Part D drug plan, and that would give you your coverage. Standalone Part D drug plans do not have to be the same company as your supplement. You could have one company's supplement and a different company's drug plan. We're going to get into the pros and cons of doing this strategy in a little while. But for now, just understand how it works. Original Medicare is billed, what's left over is sent to your supplement, and then you've purchased also a drug plan that will cover your drugs. Okay? One of the main, and we'll hit this a little more later, but one of the main advantages of this strategy is when you do it this way, Original Medicare is your primary insurance, meaning you can go to any doctor that participates with Original Medicare. One of the disadvantages we'll talk about is under this strategy, there's 3 premiums, $134 a month for Part B, whatever Medicare supplement you choose, that'll have a premium, and then the standalone Part D prescription drug plan has a premium, 3 premiums to use. So that's one way you can go with this option, is option 1, supplement and drug plan. Or if you want, you could go with an Advantage plan instead. Now, Advantage plan works completely different. Forget about what we just said about the supplement and drug plan. If you go with an Advantage plan, what happens is step 1, your Original Medicare is not your insurance. It's not your primary insurance. When you use an Advantage plan, the Advantage plan replaces Original Medicare. So your Original Medicare A and B benefits are put aside while you have the Advantage plan, or option 2 for this grid or presentation. So you have the Advantage plan, Original Medicare A and B is set aside. There's no longer the hospital deductible or the 20%. What happens is the Medicare Advantage plan, which is offered by a private insurance company, that becomes your primary insurance and your secondary. And those plans have benefit schedules. They're copay plans. So instead of your Original Medicare benefits taking place, what would happen is you go to the doctor, the hospital, the lab, they would bill your Original Medicare plan, they would bill your Medicare Advantage plan, rather. And that Advantage plan would determine what your copay would be for certain services. And they list all of them. You can look them up. It'll have a certain copay for a primary, a specialist, copay for lab work, copay for hospitalization. It looks and feels kind of like a group health insurance plan if you've ever had a group plan from your employer. Not exactly the same, but it works in the same manner. Advantage plans will also have prescription drug coverage included in them, so you don't buy a standalone plan. It's built in. Advantage plans will also sometimes have additional benefits that Original Medicare doesn't cover, or that Original Medicare or a supplement doesn't cover. But we'll get into that a little bit later. So if you go with a Medicare Advantage plan, one of the key benefits of doing that is instead of paying 3 premiums, you only pay 1 in most cases. You pay your Part B premium. You always pay that, even though you're not using your Original Medicare in this scenario. You still pay the $134 for Part B. But most, or a lot of the more competitive Advantage plans out there will have no additional premium for your medical and your drug benefit. However, they have out-of-pocket for everything you do. And the other thing they have is a network, because your doctor or provider, lab, whatever medical facility isn't billing Original Medicare, they're billing your Advantage plan as the primary insurance. As a result, there is a network which you must abide by with an Advantage plan. Okay, so let's get into our pros and cons. Okay, so if you have option 1, a supplement and a standalone drug plan, the strengths are no network. Medicare is primary. Go to anybody that takes Original Medicare. You can determine your medical coverage level. That's another strength. So if you're utilizing a ton of care, you're going to the doctor on average 5 times a month, you're in and out of the hospital, you could take a Plan F or a Plan N or a Plan G for that matter. On a Plan F's example, everything that Original Medicare approves but doesn't cover all of, Plan F will cover. You'll have no out-of-pocket, in other words. So you can determine your exact coverage level with a supplement. You can also pick a standalone drug plan that's very specific to you and what you do. So that standalone drug plan, you can tailor it, choose from one of the many that covers your drugs the best. There's very little medical management with Original Medicare and a supplement. Worry about those as much, which you would with an Advantage plan. Plans are standardized in most states. That means the plan's benefits are the same. You don't have to guess and try to do research to see whose benefits are better, because if somebody's offering a Plan N supplement, regardless of the company, the benefits are the same. And that's in all but 4 states. So if you just know what a Plan N's benefits are, or an F or a G, you know all companies will have the same benefits for each plan, and it's simply a pricing contest for you then. That's some of the strengths of going with a Medicare supplement. Weaknesses. If you have a supplement, we talked about, you pay 3 premiums. Your Part B premium, you pay the supplement premium, which can be substantial depending on the state that you're in. You can have premiums in excess of $200 a month for just the supplement. Usually don't have as many additional benefits that you would with an Advantage plan, like supplements don't include vision or dental, and the annual physical on a supplement tends to be a bit limited. Supplements are great plans, but they do have some weaknesses, and those are the weaknesses there. Okay, Medicare Advantage plan. So if you went with an Advantage plan instead, and by the way, you're choosing one or the other in this scenario. So strengths of the Advantage plan: a number of Advantage plans have no monthly premium. So they cost nothing for the medical and drug. You still pay your Part B premium, but you have no additional. Drug benefits are included in most Medicare Advantage plans. And again, that's for 0 premium. And then you can have added benefits such as dental, vision, hearing. Some have fitness club memberships. Some have really good hearing aid benefits. And on an Advantage plan, you get a much more substantial annual physical than you would on original Medicare and a Medicare supplement plan. Weaknesses of Advantage plans: well, the first is they're network-based. Medicare is not primary or secondary in this situation. Your Advantage plan is your primary and secondary insurance, so you've got to stay in the network. They only cover out-of-network for urgent care and emergencies on HMO plans, and in many states, HMOs are all that are offered. They don't all require referrals for specialists, but you got to stay in the network. And if you want to go out, again, it's only emergencies and urgent care. Worldwide coverage, but that's the only way you could go out. The copays on most Advantage plans are pretty reasonable, but what if you have a horrifically bad year? Your copays could add up all the way to the out-of-pocket max on the plan, and most plans have an out-of-pocket max of $6,700 out-of-pocket for medical benefits. And lastly, I would say managed care plans require prior auth for some services, like a scan, a major radiology scan, MRI, CAT, or PET scan. It might get held up because you've got to get prior authorization first before you can have that done. So just to summarize Advantage versus supplement, what you will see tendency is if somebody goes on a supplement, there's usually a reason. For example, maybe they want to go to any doctor they feel like original Medicare, and there's a number of hospitals out there that only take original Medicare. They do not work with Advantage plans. That person who wants freedom of choice will go with a supplement. Maybe somebody is very ill and they're going to the doctor constantly and receiving a lot of medical care. They'll probably be better off going with a supplement, a robust supplement, paying the monthly premium, and then having very little to no out-of-pocket when they go receive services. And then sometimes I get people who just say, I don't want to deal with any medical management, copays, or anything. I just don't want to deal with it. They will buy a supplement and then get a drug plan. The people that take Advantage plans tend to be people who aren't as high of utilizers. Maybe they go to the doctor 5 or 6 times a year. They don't have a lot going on. Kind of basic care needs, and they want to try to save some money. So what they can do is, if they're going to have a good year and they take an Advantage plan, they can take a 0 premium plan. They'll pay a few copays when they go to the doctor or whatever care they need, but their drug plan will also be included. So you tend to see people who are turning 65 or people with less medical needs, who don't mind working within a network, who don't receive a ton of care. They will take an Advantage plan. In some states, they're guaranteed issue, meaning every January you can switch. If you want to switch from Advantage to supplement, you can do so. And I should go back and say, in fact, you can do that in every state. Every January during open enrollment from October 15th to December 7th, you can put in an application to change from an Advantage, for example, maybe 3 or 4 years down the road after you've gotten good value out of an Advantage plan. You want to now switch to a more substantial supplement. You can do so in January during open enrollment. But be careful, some states are underwritten, meaning they can check your health when you try to go from an Advantage to a supplement. A guaranteed issue state can't do that. However, an underwritten state can. If you were on the Advantage plan and got very ill, it could lead to a situation where you want to move to a supplement, but due to health reasons, you cannot do so. There is the basic rundown of the difference between Medicare supplements and Medicare Advantage plans. I appreciate everyone attending. I hope you have a great night. Thank you.